Good afternoon, everyone, and welcome to Waterbury Public Schools discussion of reopening plan options for the 2021 school year. My name is Verna Ruffin. I would like to share with you as superintendent of Waterbury School System that I wish all of you are doing well, that your families are doing well, and to thank you in advance for tuning in and for staying the course as we navigate these very unprecedented times and we work collectively to identify some of the very best options to secure the safety of our students and our staff and our community as we move forward in Waterbury. Today, I will be speaking very briefly, but allowing time for questions relative to the reopening plan options for the entire state of Connecticut and more specifically for Waterbury Public Schools. I want to remind everyone that as a very specific direction that the governor and the commissioner of education has expressed that it is their desire for us to plan early, projecting 1.5 to 2 months out that schools are going to be opening in the fall of 2020. And with that in mind, all of the district superintendents, along with their boards, their entire community, are charged with identifying 3 plans that we believe that we can implement within our district to enable our students to continue to learn in a safe environment while assuring our parents and our teachers and our students that we are totally committed to providing the best educational options in this COVID-19 time. With that in mind, you're going to hear 3 plans that we are proposing. We look forward to hearing your input, and we are totally committed to taking recommendations and suggestions under advisement. We're only going to get through this together. And so with that in mind, I want to be very clear that one of those plans had to be a reopening of school with everybody back in school. And projecting out to August and September, that based on the data that we are receiving in the state of Connecticut and its readiness to begin opening places of public and specifically schools, that we should anticipate being able to go back in person. And if our trends continue as they are with declines in positive cases of COVID-19 and decline in hospitalization and of course, elimination of death, that we could move forward with the first plan being going back in August or September of 2020. And keep in mind that districts were charged to do this with the intention that we could also bring back to our families and our communities what those options could look like returning to a school building. And I'd like to discuss those with you, starting with the overall concept of how we have gotten to this place. Waterbury has been working collectively, both with the several committees with the municipalities as well as within our Waterbury Public School System, serving on many committees to address last school year, which ended on June 17th, as well as summer programming and summer options for our students. Our summer schools are conducted virtually. We are learning from the distance learning environment. We are getting better at teaching and learning within that distance learning environment. And we expect that we're going to continue to evolve in the provisions for resources as well as learning opportunities for our teachers and staff in this virtual world that we are all working in. So our summer schools are all virtual. So today I come to you with 3 preliminary plans, 2 of which are going to embody the underlying premise that all students and staff are going to return to school in the fall, either in person or virtually, and that this plan continues to evolve based on guidelines that we are going to receive from the State Department of Education, from health trends, from input from teachers, administrators, staff, students, parents, and community stakeholders. And so it's extremely important that we stay connected and that we ask questions, that we expect that sometimes we will not have answers because we are evolving, but we are committed to consistently providing responses to what we do know. And when we don't know, we are going to wait until we get the accurate information, and we'll share that with you. I want to also assure you that things change. So sometimes what you hear today is not what's going to be next week. And we're committed to being able to share that with you in real time as we get it. The first plan I'm going to discuss is our option A, which is all students returning to school in-person learning environment. And before that can happen for any of us, there are some health and safety precautions that we are committed to taking. And this is going to be every day for any time that we are going to reopen any of our school facilities or any of our buildings. Our Chase building is currently open now, and we follow those protocols as well. So cleaning protocols, making certain that we have those in place, face coverings, the health and safety isolation rooms at times when we think that we may have a student or a staff member that may become ill while they're on the job or in school, and social distancing. We are committed that we're going to have the soap and paper towels that are going to be readily available and stocked so that they can be replenished whenever they're used. Sanitizing stations that will be in high trafficked areas such as entryways and cafeterias and other common areas in each school. Our maintenance staff will engage in checks of the stocks and supplies throughout the day to assure that we have maintained an appropriate level of soap and hand sanitizers, as well as paper towels. And our HVAC systems will be monitored to utilize outside air where possible. We recognize the fact that we do have some buildings that do not have HVAC, and we are examining those to making certain that the airflow is of a healthy quality so that whenever the buildings are occupied, we can rest assured that they are going to be safe for people to re-enter. Keeping in mind that our maintenance staff have the sanitizing chemicals and equipment to disinfect our schools thoroughly, before entry and after the building is exited on a daily basis. They're going to be trained on the cleaning guidelines that have been issued by OSHA as well as the CDC. And there will be regular inspections of buildings, and we're going to adhere to all of the cleaning protocols. And they will be communicated regularly. We're going to redefine our work order and communications piece so that the person that can respond first to any of the questions or concerns, that person will be responsible for communicating that to the maintenance crew, to the administration, so that a team can be out and can administer to the cleanliness as well as to the protocols for all schools and all buildings at all times. We recognize that we are going to need isolation rooms on each campus in the event that once someone returns to the building, if they don't feel well. Now, keep in mind, this doesn't mean that the person has COVID-19, but we want to be aware that and very sensitive to the fact if someone doesn't feel well, they need to be immediately attended to. And in isolation, because at this point, with people being concerned, we want to make certain that we can address the person's health in a safe environment away from everyone else until a parent can pick up the child or until the staff member has an opportunity to be checked, and then they can return home and take care of themselves until such time as they are feeling better and it can be determined if they do have COVID-19. So an isolation room will be identified in every building with appropriate signage. There will be protective gear. In some instances, depending on if someone is caring for someone who doesn't feel well, they're going to have protective gear beyond the required masks and or gloves. So that will be provided. And of course, if a student or a staff member has to be isolated while in the work or school environment. They will be monitored until such time as that person can be attended to in the privacy of their own home or the doctor's office. We are going to also apply tracking and contact tracing of students and staff members. If someone doesn't feel well, or if someone does contract COVID-19, we want to know who that person was in contact with so that they could be notified. And we will work very closely, as we have already, with the Waterbury Department of Public Health. Again, students released to the custody of their parents. We're going to make certain that we have the correct phone numbers and contact information before anyone re-enters the school building, to assure that when we do contact someone, we're contacting them at a valid number, and that they can respond immediately. The isolation room, in the event we have to use it, will be sanitized every time and disinfected. We are going to contain, these containment plans and protocols will be followed, and we're going to review constantly in the event that we need to revise any of those. If we have to quarantine someone, we will make certain that the communication is shared with all of the people within a particular classroom and certainly a school, and we're going to be very transparent with that. While recognizing confidentiality of an individual, we want to also be cognizant of the safety of everyone. Return to work or school will be dictated based on the medical review that will be provided in advance should someone need to be quarantined. We are aware of face coverings, and all teachers and students, administrators and staff and visitors, if we were to have visitors in the schools, would be required to wear protective face covering and mask that covers the mouth and the nose. And staff and parents are encouraged to supply a clean cloth mask to wear daily, but any child who needs a mask will be provided with a cloth or disposable mask before entering the school or entering the school bus every day, to make certain that we are in compliance with our requirement to wear masks at all times while in the building. We will respect social distancing, keeping in mind that we have had some changes in guidance relative to social distancing. At one time, it was thought that we needed to be 6 feet apart. Some of those guidelines are being rethought. And in some instances, we're getting some guidelines that says that it's not required that it's 6 feet. Maybe it could be 3, but at any point, it still needs to be a social distancing. So between now and before August or September, we may get additional guidance into how far apart that social distancing space is. For the time being, we are going to make certain that there's social distancing within our schools as well as within our school buses. And we will apply specific signage so that walking areas and walking spaces will be clearly marked to make certain that we adhere to that. Assemblies and large group meetings or gatherings will be limited where we believe we could not follow social distancing. We're going to pay attention to that. Each campus will have a designated school liaison. That's going to be a designated employee to serve as a COVID-19 health and safety compliance liaison. And this person is going to be responsible for engaging students, parents, faculty, staff, administrators to answer questions that people may have, because we are in an unknown kind of environment. So we may have questions. We may have questions that pop up every day. We need to have someone that we are going to be able to connect with that can provide those answers. We are also working on the nurse or nurse's aide at each campus and rethinking how that could happen in cases where we have school campuses that share a nurse. We want to make certain that we would have a nurse and or a health aide at all campuses, so that even in the sharing, we're not going to be sharing the full-time person on that campus to address any health needs of our students and our faculty. We're also considering schedule reconfigurations that will allow more frequent hand washing of our students, and as well as guidance for our families and our staff to help them to know when someone should stay home, and guidance for our teachers regarding students who may not be able to abide by the mask mandate. And of course, emergency contact information for everyone. There's so much to be thoughtful about in considering health and safety. It is a top priority. And I will share with you that even through the surveys that we have so far been receiving, we see that continues to be a top priority for safety and the health of everyone. And we are taking this very serious, regardless of which plan we implement in the fall of 2021. We will also intentionally focusing on teaching and learning to make certain that our students are going to learn in an environment that's conducive to their learning style. We're going to emphasize grouping of students to try to the very best of our ability to keep students in similar groups so that they do not have to be dispersed across the campus or certainly walking out in the hall without being able to identify which class that they belong in. We're going to emphasize the grouping as much as possible in all of the 3 grade levels, recognizing that it may be easier to do this in elementary schools, maybe even elementary and middle schools than it might be in high schools. But we want to keep students as closely as possible into these cohorts so that in the event someone didn't feel well, we would be able to contact all of the students that were in contact with them so you would know that it was confined to this particular class and this class meets together for these number of hours every single day. We would want to monitor student arrival and departure, the way students are going to be eating meals, their movements throughout the school, and we're going to utilize a maximum distancing while utilizing building spaces throughout our school, and of course, distribution of staff and available supports where possible. We are going to be cognizant of that, and we're going to be working with our students, our families, and our teachers and staff in making those provisions as students are going to be taught inside of the classroom. Parents will have an opportunity to access teachers by mail, email, phone, and in virtual settings for one-to-one meetings. We have learned through the beginnings of distance learning that the closer we were able to get to the classroom and the person that came in contact with the student at the closest level that that student was going to be connected, which is the teacher, that we got much improved results. So we want to make certain that while we're not going to be able to open the door for everyone to enter the building, we want to make certain that the access to our teachers is going to be provided through a lot of virtual means. As I mentioned before, reconfiguring individual classrooms, monitor social distancing, and guidance will be provided for our teachers in regard to best practice for student collaboration, working in small groups, and sharing of materials. We are very much aware of that. Our transportation, we recognized that many weeks ago, there was guidance to limit the number of students that would be able to have ridership on a school bus. That has changed, and it could change again. But at the time being, it has changed to not require any limit on a school bus. But we're going to make certain that it's not 3 students to a seat. So as we monitor this and as we learn together how many students are going to need to ride a bus, we're going to make certain that we can either provide the bus routes to accommodate that, and of course, following safety protocols. And such as we want to make certain that all of the bus drivers and any of the bus monitors are going to have masks, and where it's feasible, any other protective gear that they may be required depending on the need at the time. And we're developing a plan to actively increase social distancing protocols based on the community spread. And we're keeping in line with the guidelines from the Connecticut State Department of Education, who have issued those guidances. Parents and guardians will be asked to pre-screen students prior to them getting on the bus. And of course, any student or staff with fever or any kind of COVID-19 symptoms are being asked to remain home and to not ride a bus and to not come to school. Students would practice social distancing while waiting for the bus before boarding the bus, and of course as they're exiting the bus as well. Students will remain seated while on the bus. You know, the aisles will be cleared. There won't be any switching, and we are seriously looking at the bus seating charts to assure that we know exactly where every student is going to be seated every single day. Again, following the same protocol and recommendations of trying to keep students in the same cohort of classes. When necessary, we're going to adjust bus routes or schedules. We'll consider and review daily the number of students that are riding the bus, and we're going to monitor that, and we're going to reduce or eliminate as needed to assure that we have the appropriate distancing while on the bus. We also are very much aware we're going to pay attention to our special education transportation. We want to be consistent with the student's IEP. And we're also going to ask our parents when it's possible for them, if they are able to transport their student to and from school. If parents are going to, would like to do that, can do that, I think it reduces the ridership, but parents may at that point want or need before and after school care. We want to put that into our plan to consider parents' needs for before or after school care if you're going to drive your child to school. And then of course, parents will, if you're choosing that option, we would ask a parent then to apply that for an entire fall semester. And the reason why we're asking that for an entire semester, it allows for us to be able to plan better so that one day we don't have more children on the bus than another, because some days you're transporting and in other days they're asking to ride the bus. So at least to commit for a semester at a time, that way we can evaluate it at the end of the fall to see if we needed to change it in the winter. Of course, the bus company and the transportation vendors will sanitize all of the buses and vehicles daily and between runs, consistent with the CDC guidelines. And in the event of a documented COVID-19 case, the bus or the vehicle will be immediately removed from service in order to completely sanitize the bus or the vehicle. Face coverings would be worn by the driver as well as the students and any other personnel on the bus. We ask our staff and the parents to supply a clean mask for our students to wear daily, but any child who needs a mask will be provided the cloth or disposable mask before entering the school bus or the school. And the district will honor specific medical exceptions for students who are unable to wear a mask. And in such cases, face shields may be utilized if applicable. We want to try to be as consistent as possible with safety as the #1 priority. Our crossing guards will wear face masks as well and assist with any kind of increase that we may have in our trafficking, because maybe more students are going to be walking or parents dropping off their children to school. This would be the in-person model. We would follow all of those protocols for any time a person returns back to school, and we're consistently updating those as we receive guidance from the CDC and or the state. So that's part one of option A of a full returning back to school. That's what it would look like. For students and parents, teachers who would not opt for that return to school option in person, because remember, part one, plan one for the school districts across Connecticut is planning on everybody returning, with the exception for what happens if someone decides that they're not returning. What happens if there's a pre-existing condition that would cause someone to say, I cannot return for whatever reasons? Then we would have an option B within that plan one, still being back in school, but being back in school virtually. So you're not in the physical building, you're receiving district distance learning as an opt-in. And again, you would opt in for all of the fall semester. You would be asked to make that. Parents would be asked to make that commitment. It would be a distance learning model that we have continuously worked to improve on and to refine. Students would see their teachers and their peers in a virtual setting on a daily basis. The district will transition to a blend of both in-person and posted lessons that would allow the student to work at his or her own pace, but we would have schedules. And so this would be, the instruction will be provided by a live high quality teacher support via office hours and instruction on a regularly scheduled basis. And that would be for the 2021 school year for someone who opted to return, but returning in a virtual setting. Again, we would ask that the commitment will be made for a semester so that we could make certain that our classes are well balanced. We have a sufficient number of teachers to teach in that particular model, but we would be able to provide a distance learning option as a part of Plan 1, which is everybody back to school. We're going to continue to use Google Classroom in addition to online resources for distance learning, and we're committed to working vigorously in the virtual environment. This includes accessing content that's online, which is including videos posted by teachers, and teachers will continue to engage in professional learning activities to improve their distance learning skills, including the opportunity to become Google certified educators. And many of our teachers have already completed that training. This is a part of what option 1 looks like, everybody returning. In person or opt out for virtual. I'm going to go to Plan 2 now. Plan 2 is what we call our hybrid model. That is, all students return to school, but it's a hybrid model. It's part in-person and part virtual. Students attend school for a full day, but it would be either a morning session in person with their teacher and in an afternoon with their teacher, but virtually. This plan, while it's called a hybrid model, also follows all the safety protocols that I just discussed with all of you. Every single detail of that health and safety, as well as teaching and learning, would apply in this hybrid model. The difference being that the half day of in-person instruction for students who choose to go in physically in the morning, that way students can return home in the afternoon and they can engage in what we call a flipped classroom for the remainder of the day. Flipped classroom meaning that they would receive their instruction virtually. We would continue to have after-school programs for parents who have chosen to enroll their students, continuous enrollment in after-school programs, providing our funds and our logistics allow for us to have this. A half of a day of the staff time would be dedicated to distance learning support for the virtual students, including office hours and Google Classroom meetings and updated content. And depending on circumstances, the district could also adjust this option, including a returning to a more traditional schedule and or leveraging more virtual options with proper notice. And we left it that way because we believe that things are going to evolve over time, and we wanted some flexibility to provide the very best options for all of the children and the teachers and the staff as possible. The part B of this same hybrid model plan is for parents or students that opt for a virtual academy, and there will be an opt-in. You say that, my preference is that I'm going to attend virtual K-12. I'm not going in for a half day in person. I'm going to use the virtual K-12 academy option. You would sign up for this. You would remain in it for the entire fall semester. And students would work in the morning asynchronous, which means that they would have the opportunity in the morning to do some work that's already in Google Classroom, watch their teachers teaching, but in a recorded time, access lessons and access work that they would work on in the mornings. And then in the afternoons, they would meet with their teachers. So the distance learning would as I stated earlier, would continue to evolve as we get better at this, both on a teaching and learning sense, as well as listening to what our students and our teachers are saying they need in terms of resources to be more successful learners in this environment. Again, we would use the Google Classroom. We're not deviating from that, and our teachers are committed to continuing to learn and develop skills as certified educators within that platform. I will go to our third and our final option, which is total virtual, no in-person. This would be in the event, based on the stats that we're getting from the state and the information we've gotten from the governor as well as the commissioner, this would be an option that we would apply should we have to go in another mandatory school closure. And so that being the third option for us, it would be a total virtual K-12 academy. Again, it would be full distance learning, very similar to all of the explanations that I shared with you previously, except it would be all virtual for all students and staff, and it would be provided with a level of quality and continuous learning that we are committed to moving forward. It would be real-time instruction from the teacher to the students and opportunities to continue to evolve in a virtual platform. And that would be our third option. And there are several people that have worked on various committees, and teachers and staff and students and community members and partners have worked for a very long time. So we didn't only start working on this a month ago. We've been working since April and May and June. But we haven't been working on April, May, and June on what's going to happen in the fall. We started that almost 2 months ago, thinking about what we're going to do in the fall. And then about 3 weeks ago, the release of the plan from the State Department with some specific guidance about how we should develop our plans collectively, and we continue to develop those with the feedback from lots of people. So you're looking at various committees that have been meeting and will continue to meet until we have a plan that is going to be submitted to the State Department by July 24th. We have explored opportunities or some options of changing the start date of school from August 27th, which is currently on our school calendar, and we are anticipating we might change that to September 8th, because we're told that we could get additional guidance on August 1st, and we believe we can get some additional guidance on September 1st. So we could have a school delay start until September the 8th. And then, of course, the district is using a new platform called Thought Exchange to gather input on the reopening of schools. And I am so pleased that, a number of people have taken advantage of this, going in and sharing your thoughts and rating thoughts. I was so pleased at the very first hour that it was launched. We had hundreds of people that were already exchanging thoughts and sharing their thoughts. We have various surveys that we are going to use to help us define and refine our plan. One is the Thought Exchange that is still going. It will be closing at 8 p.m. this evening, but we also had a teacher and a parent survey on distance learning, which ended on July 8th. It's going to take about 2 weeks before the data is returned to us so that we could share it with you, but we're going to use that information to help us develop our plan for distance learning. And then we also had 3 forums last week where I had an opportunity to meet with students and some our parent liaison with Deepak and with our community stakeholders, as well as members who served on various subcommittees, both subcommittees for the reopening of school, as well as subcommittees for our strategic plan. And we're going to take all of that information, plus what we're going to be hearing from you today in the town hall meeting. And we have 2 other town hall meetings thus far that are scheduled. Now, that may not be the only meetings that we're going to have, but those are the meetings that we're going to have that will help us to be able to shape this plan. And we'll schedule many opportunities to discuss the results of some surveys and to assist us in moving our district forward. I will stop there, and then I will be able to respond to questions. I want you to also know, before I start responding to questions, I am committed to listening more than talking. So if you have some things that you're saying, you're sharing, I will listen. If you ask a question and I do not know the answer, which is going to happen, we are building something that has never been done before as a nation, because across the nation, as districts are being charged with reopening schools or not opening schools or thinking of innovative ways of opening schools, the answers are just not there for everyone. It's not like you already have a model that you're definitely going to implement. You're trying to build the best model for your school district and your community as possible. It's not a one size fits all. We know that. And that has been shared numerous times by our Commissioner of Ed. And we respect the fact that we have a unique opportunity in Waterbury to do what's best for our children and our teachers and our staff and our community. We want to do that very thoughtfully, and we want to be respectful, knowing that these are indeed unprecedented times, but we want to be able to make the very best decision possible. And so I'll open it up, but I do want to recognize two commissioners that I saw join, and that is Commissioner Brown and Commissioner Harvey. I don't know if I have any other commissioners that have joined, but I did see very briefly those two commissioners in the screen that now I'm not able to see. So at this point, if you have any questions, I will certainly listen and or I will respond.
All right. Thank you, Dr. Ruffin. Is a Charles Marcellus on the line?
Yes, I am.
All right, sir. Go ahead.
Hello. Hi, Dr. Ruffin. How are you?
I'm well. How are you doing?
Here. Good, good. I just want to thank you for all the hard work you're putting into this. I could see it's very stressful, and and I think we all appreciate the amount of work you're doing. It just looking at your face, I could tell you're working really hard. I have some recommendations. Okay. I did have a question, but you sort of answered that about the ventilation. But as far as opening up school, you had mentioned something about the virus being, maybe only 3 feet away or 6 feet away. It's an airborne virus more so than on the surface, and it's going to have to be a minimum of 6 feet. And I've heard your 3 different options there, but the one that I have thought about for quite a long time, and I think the one that would work the best, would be having school every other day. And there's a lot of positives to that. I think it would ensure the health of the teachers, first of all, because I think some of these kids coming to school, maybe quite a few of them are going to be asymptomatic. And the children are. And the high school kids are going to be even more dangerous, whether they realize it or not. And I think the elderly teachers, I know if I were an elderly teacher, I would not be coming back under those circumstances. As you're saying, no size fits all. But I think if the kids can go to school every other day, they're going to get individualized attention. It's going to be much easier on the teachers. You can't put that many kids on a bus because it's going to be airborne. It's not so much the surface. And can you still hear me?
Yes, I can hear you.
Hello?
I can hear you.
Oh, okay. All right. And I think if they're going to school every other day, there's a lot of positives to that. Kids could be going home that second day and getting plenty of assignments to do to cover that whole day. And, the idea of them going to school half a day, I think it's just going to be very chaotic with the buses. The teachers are going to be worn out. And, I think the kids will have a lot more time to read and write at home and to bring that work back the following day. And I think the teachers are going to feel a lot safer that there's a smaller community there. And because this COVID is not going away, and it's going to, if we send all these kids to school, it's going to explode in the fall. I have no doubts about that. And Connecticut is one of the best states as far as controlling this virus. But when you put that many kids on a bus or in school, the same day, these kids are asymptomatic. We're going to have kids coming from out of state that are going to be going to school. I see a lot of New York plates. So, and the high school kids, teachers are going to be scared, no question. And I think going to school every other day, you might actually see an improvement in the scores. And everybody's going to be much more relaxed, I think, going in that situation. If you try to get everybody in school every day, it's going to be crazy. Virtual learning, there's a percentage of kids that will not do that. And they're going to lose out on their education completely. I think you know that as well as I do. There's kids that are just not going to feed into that because they don't have structure at home. But if they go to school every other day, there are so many positives to that, and the parents are going to feel so much more comfortable with it, the ones that want to send their kids to school. You cannot put 30 kids on a bus with that air circulating there. Those kids can spread the virus just like an adult can spread the virus. So I think, every other day would be exceptional. The days that they're not in school, they would have plenty of work. They would bring back the following day. Teachers would be more relaxed. They would get much more done. They would get to know their students a lot better, and it would cut down on discipline tremendously. I don't think you're going to have that problem at all this year if you do something like that. So thank you for listening to me. I think I thought this out a long time, and I think that would be a lot easier for you and everybody else in the school system, because if any other way, I think you're going to see a lot of older teachers retiring. They're just not going to go back. High school kids spread that virus just like adults do. There's no difference. Thank you, Doctor.
Thank you very much for calling, and thank you for your input and your suggestion. I appreciate that. I also want to take a moment to recognize Commissioner Tom Vanstone, who's on. I'm told, again, I don't see you, Commissioner Vanstone, but I hear you're on, and I can't see anybody right now. So thank you very much for being here as well, Commissioner Vanstone, and Commissioner Harvey, and Commissioner Brown.
Rebecca Cook, please go ahead.
Hello.
Hi.
Hi, how are you?
I'm well, thank you.
Oh, sorry. I'm just a little bit nervous.
Well, that's okay.
I'm a para. I work for the city of Waterbury. I used to be a substitute, and I have a lot on my mind. Going back makes me extremely nervous. I'm also a mom. I have a young daughter who attends the public school in the city of Waterbury. And I'm immunosuppressed, and I know a lot of my coworkers who are also immunosuppressed. And going back, I think of how we cannot be 6 feet apart. I work at a school that it's impossible. We're hands-on in my school. And we've also been working at a place where we haven't had a nurse in 15 years. And I know you said that we're going to have a nurse, but I'm sorry, right now I don't believe it. And it's just, there's so much. There's the nurse, and I work with a lot of older teachers, and this virus has taken most people who are 45 to 65, and 30% of the teachers in the U.S. are over the age of 50. And on top of that, most schools, you can't even find soap. We have to buy our own soap for the children's bathrooms, for the bathrooms in general. And on top of that, I keep thinking about how are the kids going to go back and wear masks? You can't get them from stop picking their nose. And in my school, we can't get them from stop fighting. I'm sorry, I don't see it. I don't see the logistics of it. We can't get our kids to stop throwing chairs and desks, and I don't see how logistically it's safe for some schools to open up. I hear how Charles was saying open up every other day. Some schools, I don't see how it's safe to go back. And I'm all for, I understand how the kids need to socially go back, and I don't see how it's safe. And then what happens when you have a staff member who comes down with it? Do we have to use our sick leave? Is it going to be covered? You said how it's the buses, you're going to safely distance the kids on the buses. How are you going to safely distance us inside of the school? Are you going to have tents set up? Are you going to have the extra buildings like you did? I think it was at Chase School how you had the extra tents when the school was remodeling. I fear for my daughter. I fear for the other kids that I loved, my students. I just see so many. I understand that right now Connecticut is low in the numbers, but I have so many of my students that they travel. They travel every weekend because the parents do not understand. And they come in with other illnesses. They're going to come in. They're going to bring it in. And I don't see how we're going to keep COVID down. The numbers are going to rise. It's going to come back. It's going to come back very hot. And phase 2 of COVID will come back. Sorry for being very anxious, but I just see a lot of my coworkers getting very ill. I don't want it to happen, but I see the kids in our school system getting sick.
Thank you, and thank you for your input. And actually, the guidance from the State Department and the guidance from the CDC in terms of transportation really has removed some of the restrictions on that. So the social distancing on a school bus is no longer the restricted that it was 2 months or 3 months ago. And what I said was we were going to pay very close attention to that to make certain that we could provide all of the safety protocols, like identifying seating chart to make certain everybody sits in the same place, and of course the sanitation of the bus between routes and at the end of the day. But the restrictions previously noted several weeks ago are no longer in existence for this new guidance that we have recently received. But we are committed to monitoring everything. And of course, we are certainly respectful to listening to everyone's concerns, because we know that this is a critical time for all of us. And we want to be cognizant of that and certainly respect the fact that this is a very uncertain time for everyone. Thank you for your input.
You're welcome.
E. Vaker, please go ahead.
Hi, Dr. Ruffin. How are you?
Well, how are you doing?
I'm okay, kind of nervous. So I'm actually, I'm a parent, but I'm also a support staff at one of the schools here in Waterbury. So my questions are going to come from both sides. So as a staff person who was just able to do my job remotely for 3 months, I'm rooting for the online all day. And that part of that is because I'm going to potentially be exposed day after day to the virus. A lot of people say come back. It really hasn't left. And I understand that the numbers are low as far as transmission between children, but I think the majority of that has to do with the fact that schools were shut down at the beginning of the pandemic. So while that data is accurate, to me it's kind of inaccurate because it's never really been able to kind of be, accurately measured. As the parent part, I was just wondering, how will we be notified of either students who are potentially exhibiting symptoms or who test positive? I know the goal is to have children in small groups within the classrooms. So if a child in group A shows symptoms, but my child is in group C, will all parents of the classroom be notified, or will just the parents of children within that small group? And will you require testing specifically for COVID for children who spike a fever in school, who may have, a continuous cough? Will the specific COVID test be required? And as far as if children and staff members have to isolate, I know last week we were told that we will have to use our sick time. Will those absences go against students? So if it's a 14-day isolation period and it's a 20-day cap for absences, will those absences go against the student. That may be a question you can answer now or down the road, but those are really my main concerns. I have a child who has a medical condition, so but at the same time, I'm now being told I have to go back into the school. So, like I said, I'm concerned for both of us, as a staff member, but also as a parent. It's warm outside. Even right now, it's uncomfortable as an adult to wear a mask. So to have 4-year-olds, 5-year-olds, 6-year-olds, kids all day in classrooms that are already small, where the ventilation systems are not good. Some classrooms don't even have air conditioning. My child's in a school, there's one bathroom in the entire school. There wasn't even soap, so those are, and I know you said that there's going to be funding and there's going to be guaranteed. Well, I was hoping, as a parent, those things were guaranteed before. How can you really assure us now that all those things are going to be taking place? I'm worried about, like Rebecca said, the crowded busing, and now the small classroom. So either way, kids are going to be, they're going to be cramped. And to me, that just means more exposure and the risk of being exposed. So thank you for your time. Thank you for listening.
Thank you. And thank you very much for your comments. I can't answer all your questions right now. I can tell you that it is our full intent that if someone were to contract COVID-19 or someone were to display those symptoms and report it to the CDC, which is the health department, which is what we have in our protocol. We have done that before, and that's what we would do. And then we would notify everyone within the content of that class. So if it's in a class, if it happened to someone in the class, whether it's the adult or the child, we would communicate with everybody very transparently. Of course, respecting the confidentiality of the individual, but full disclosure of the particular symptoms so that everybody could be aware of what occurred. And we would also, while I can't answer every single question about the attendance or what kind of leave, I can't answer all of those questions at this moment, but we are in conversations to determine how that would be applied. With the option that we currently have for virtual, however, it is possible if someone were well enough to be able to still continue to receive some kind of instruction, that the virtual environment would provide that so that it would not be detrimental to the learning that would be ongoing. But again, if someone is very ill, we certainly wouldn't expect someone to still be engaged in virtual, but you do have some flexibility in virtual that could allow ongoing learning at your own pace and time that you may not have if you were in an in-school solely environment. But thank you for your questions, and thank you for posing some questions that we may need to answer as we move forward with our plans. I could certainly respond to the safety protocols and the cleanliness and the soap and everything, because if you saw that one of the plans, that it was very clear to place that contact person who would be ready and available, kind of a checklist to make certain that everything is in order. Certainly ordering multiple supplies and backup supplies to replenish any soap or any paper or anything that we're missing, to make certain that they're also supplied to the individual bathroom or school as we needed it. We recognize the fact that there are many times that that consistency across all of the different buildings didn't happen, but we also recognize the protocol by which one would notify someone that this was missing was not always applied. And so we want to make certain that it is. And I think that since the Board of Education, the State Board of Education voted today that the 180 days of school is no longer applicable. They've waived that for this 2021 school year, and allowing 3 days that can be applied to training of staff and training everyone. I think that would be time well served to determine who exactly is going to be monitoring that? What's the protocol? Who do they contact, and how quickly you can expect that there's going to be a resolution to that in case we do have any of those problems. And earlier, someone mentioned, you didn't have a nurse and you didn't believe you were ever going to get one. Well, I think that's incumbent upon us to make certain that when school opens, certainly in the safety environment, that we will need to work with the health department, because our nurses are provided by the health department. We'll need to make certain that we either have a nurse or a nurse aide. Remember, the plan says a nurse or a nurse aide. And we are learning every day that the role of the health aide can be a repurposed position. So we can train someone to be able to be that, so that all of our schools have one, in addition to the nurse that we currently have in our school buildings. The health department did not say they were going to give us more nurses, but we have figured out ways that we could perhaps get more health nurses to supplement the already number of nurses that we have within our district. So that would be something that we would commit to. It wouldn't be a suggestion anymore. It would be part of the plan that we would actually have in place prior to opening schools. Thank you for your question and your comment. I really appreciate that. We have another caller or another question.
Liz O'Brien, please go ahead.
Hi, good afternoon. How are you, Dr. Ruffin?
I'm well.
I will try to get through my questions without crying. I have 2 6-year-olds that are, that were in kindergarten this past year, and we, didn't really do great with the virtual learning. However, as a parent and also as a nurse for 17 years, I have a lot of concerns of going back to full in-person school. Yes, the numbers are really good in Connecticut right now. However, the past, 24, 48 hours, we have over 200 new cases. Yes, the hospitalizations are going down, but it still has an increase, again, a little bit. They believe that Connecticut's numbers are so well now because we did a really great job of staying home and wearing our masks and doing the right things. The governor just decided to postpone phase 3. So there's obviously still concerns about safety. These virtual town halls, I'm not sure if you're planning on doing any in person. I mean, if this has to be virtual only, then that gives me pause to think of why kids would be fine to go back full time. I was hoping for some type of hybrid model, which it sounds like you guys are trying to work on. However, if you do a half a day, or as someone mentioned, every other day, that's still the same amount of kids in the classroom at one time. So that doesn't really count, cut back on the amount of contacts they have. I do have a friend that lives out of state who they're trying to do a suggestion of Monday and Tuesday, Group A goes to the classroom. Then Wednesday, they clean everything. Group B goes Thursday, Friday. So you have your in-person learning and you have your virtual learning, but you have a smaller class size and you have that day to kind of, so-and-so was sick, so let's do a deep clean. So, it gives you maybe some more options. I think a half a day in school and then, virtual afternoon or vice versa is going to be very hard for parents that work to get arrangements for a half a day all the time. If it's hard. Again, if a positive occurs, like what happens is the whole class quarantine. And then if this happens multiple times, within one semester, to have them go to school, home for 2 weeks, go to school, home for 2 weeks, I'm not really sure if that's good. I know that I also, at having 6-year-olds, worry about socialization, but if they're not going to be doing, close contact in small groups, if they're not sharing supplies, if they have to, stay at their spot, if they have to have lunch at their desk, I mean, are they even really getting a quality socialization experience out of that? Parents sometimes send their kids to school perfectly fine, and 2 hours later they have a fever, and then do they have to go, the whole class have to go home? I know you mentioned an isolation room, which is obviously a good idea, but I'm just, trying to figure out more specifics. And also, if, a lot of parents want a virtual plan or a hybrid plan, but the school district decides that, yes, based on, the numbers, we could do an all person all the time. Do they not get to decide? I mean, if they're in school full time, and it's because that's option one is what you guys went with, but we wanted a hybrid model, there's no option to have that. It's either kind of all in person or all virtual, but the school district would decide on the hybrid model, what it sounds like to me. And I'm not sure. If you do decide on a virtual model, you did mention you could have some, virtual meetings with the teachers or by phone, but if one of your students or one of your kids needs extra help, how would that be able to come about? And the numbers in Waterbury, if you look at the Department of Public Health, are way higher than a lot of surrounding towns because of the amount of students in the, city and the amount of buses and all of that. Everybody talks about when the next wave or second wave will happen in the fall, which is pretty much guaranteed. What do they do at that time? I just have a lot of concerns. I could go on and on, but I'm sure there's other people that would like to give their thoughts. So I thank you for listening.
Thank you, Ms. O'Brien. Well, I can tell you that the questions that you pose are questions that we ask ourselves multiple times every single day. And we have, in fact, thought of some other models that we actually considered. We didn't list them as one of our top 3 because we also are still thinking about the reasonableness of having someone come on alternating days and maybe not getting confused if we need different grade levels on certain days. We're trying to provide 3 plans that could be easier for people to remember and to do and to apply with the best option for tracking or tracing that we possibly could apply, considering the fact that we do have a number of our buildings, especially our elementary schools, that are not air conditioning. So they're air conditioned. So we took that into consideration as we presented these 3 today, and these 3, but all of the suggestions that we've heard from, alternate days to, we've thought about them, we're thinking about them, but we also wanted to apply 3 models that we thought that if we did have to apply within Waterbury, they're less confusing. It doesn't mean that we can't go back or won't go back and rethink those, but the half day or the partial day in person gives you an opportunity to know who's in the building every day without having alternate days. Maybe parents not able to always provide the home care on the alternate days. So we considered all of that. So that's why it's really good to hear from our parents and our faculty and staff and community as we continue to think about what our options are. So there's a lot of unknowns. All of those things were excellent points because we don't know. We absolutely don't know. And we have to, at some level, we have to say, we just don't. And are we going to figure it out? We believe that in time we probably will, because we're playing with a scenario right now of the what ifs. What if everybody comes back to school? Which is the first plan, which was stated, both by the governor and the commissioner, everybody has to go back. That's your first plan. So in everybody comes back, we provided a plan for what happens if everybody comes back. And then the what if someone can't come back, we provided that option in a virtual setting as well. But if someone were to contract COVID, yes, we would be very transparent. Notification of the health department is certainly one of the protocols that's listed there, but we notified everyone who came in contact with that in that classroom, and then we would have to make decisions along the way, both for the individual family as well as what we would do with the entire classroom. So yeah, a lot of unknowns, a lot of things that we cannot possibly answer today. But we don't know how many people it would, if we go into the hybrid model or we went into the virtual model, we the option, we don't know how many people we're talking about. So the challenge would be in staffing it, also in the provision of what does that schedule look like, and when do people come on and when do people leave the classroom, or we have a lot of unanswered questions in any one of those models, except perhaps the virtual one. But we're working on it.
Dr. Ruffin, Carl, could I interject one thing? Hello?
Hello?
Dr. Ruffin?
Yes.
Yeah, this is Charles. I just wanted to interject one thing. I just wanted to make it clear that when I said every other day, I would mean that if there was a class of 28, 14 kids would come on one day and 14 the next.
Sure.
One of your callers made it sound like I wanted all the kids to come every other day.
Sure.
No, the class would be broken in half.
Yes. Thank you.
Oh, okay, that makes sense.
Yes. Thank you for
Yeah.
clarifying that. Yes. We've thought about some
I
of
think
that.
that is
We
common
don't
for a
know
lot
if
of them.
we would come back. At this point, we're still gathering data, but I thank you for clarifying your comment that you were meaning split the class. Some come today, some come another day.
Right.
Thank you.
All right, Cynthia Leonard, please go ahead.
Hi, good afternoon, everyone.
Hi.
I just wanted to say thank you. I think you guys are doing an awesome job. I don't envy your position. It's a lot of stress on everyone. My opinion on the matter, I work at a school as well as being a parent. I think Connecticut's doing a great job because we've been social distancing. And I think if everybody were to return back to school, all that goes out the window because the students will be carriers, if not, and, you know, getting it themselves. They'll be bringing it home to their family members, and the teachers will be bringing it home, and it's just going to spread like wildfire. I would like to question, are staff being provided all three of those options? If a staff member is not able to come back to work due to a underlying health condition, that's one question I have. And then a second question I would have is limitations of the parents. Like the school I work at, we spend a half hour doing late tardy passes. That's a lot of contact, a lot of kids in line, a lot of parents, early pickup, same thing. Working in the school, I honestly can't see. I mean, yes, we can put every best effort forward, but I cannot see social distancing working at 100%. It might work at 40%. Again, that's my opinion. I greatly appreciate that all these different avenues that are being offered. And I just want everybody to stay safe and be healthy and have you take every option into consideration. And I second everything Rebecca said. And there you have it.
Thank you. Thank you so much for calling in. And yes, we have sent out surveys to our staff as well as to our teaching staff as well as to our administrative staff to find out what their status is and given what the plans are, their intent to prefer one model to another. And when I say model, I don't mean model 1, 2, or 3, but rather would they be poised to return or not? And we're trying to gather that information from our students, from our staff, so that we can make the best decisions for the district.
No, and pardon me, I didn't mean to interrupt. I didn't see one for staff. When I looked everywhere, I saw one that said for teachers and one that said for parents. So I filled out the one about the parent and online. And I mean, that worked great for us, but I see where like it's not a one size. But was there a staff one that I should know about?
I didn't see one either.
The thought exchange one has a place there to indicate whether it's a staff member or a teacher. I remember seeing that one. So the thought exchange one, the one that closes at 8 o'clock tonight, breaks it down. And then the teacher one, I think went out last week, maybe Friday. And then the administrator one, I think it either went out last night. or this morning.
Right. Now, let me ask you this really quick, if you don't mind. So if you have a staff member that has either an underlying condition or they're over the age, are there accommodations going to be made to allow that person to feel more comfortable at work, like limiting people in the office or extra protective, like a shield to cover eyes, or, any, plexiglass around their specific desk? Is any of that being made available?
In some areas where in the area for the spacing, if there was a spacing issue, I think plexiglass is something to be considered. Definitely the protective gear, especially as it comes to masks, that's being provided. And we are taking the precautions for our students and our staff to be able to have those PPEs when they come into the building and, of course, throughout the day.
Okay, great. Thank you for your time. And again, you guys are doing a great job. So thank you very much.
Thank you for calling in. Appreciate you.
Dr. Ruffin, that completes the list I was given. Are there any additional callers on the line?
I'm not.
I have one last question, if that's okay.
Yes.
This is Rebecca Cook. One last question.
Yes, go ahead.
I see a lot of other states that they're changing jobs with people who already have jobs. Will that be conducted here at all?
I'm not sure what you mean.
Like down south, for paras and everything, that they're changing jobs that since a lot of the jobs can't be done down there, they've let go paras. Do you know if our jobs are safe as of now?
Oh, I know. You mean like a repurpose of a person's job to be able to do something that becomes needed in the new setting that may not be done like it was in the past? Yeah, I believe. I believe that our
in terms
district.
of the fact that if kids don't come back, in terms of if the kids don't come back, they've let go a lot of the paras.
We have never had a conversation about.
And a lot of the.
Excuse me. We've never had a conversation about letting go of people, but we have, and we will probably continue to have dialogue about what happens if some existing roles are no longer needed, and we need to describe roles and repurpose roles and redefine roles. We have had that conversation, and I see that based on where we go with this, that is probably going to be a conversation we will take forward. For instance, in a virtual setting, if that were the case, then there could be some jobs that were performed in-person teaching and learning that would no longer be needed in a virtual. So repurposing the staff to redefine the position in a virtual world might be in order.
No, that's understandable. I was just wondering because us paras have been watching a lot of states getting rid of paras, and it was just nerve-wracking.
Yeah, I'm sure they would be.
Just wondering if we're still going to have a. Just wondering if we're still going to have a job.
I guess the whole thing
thank you.
Is very nerve-wracking. I can certainly understand that, but our role at this point,
it's just scary.
How we can respond.
There's many things we're worried about, like if we go back to virtual, if we're still going to get paid, or if there's many things we don't know about because we don't get emails at all.
Yeah, I don't know why you don't get emails, but we post everything on our website, so please do.
We don't. Well, we get that, but we don't get emails as to like what's going on. Like when we went to there's many things. So there's a whole long list. We don't get certain emails about what's going forth.
I do send emails to all staff, and so.
Well, we get your email. Well, we get those, but we don't get as to like what's going on, kind of thing.
Okay, I send emails about what's going on, and I'm going to continue to do that. But we're going to post it also on our website so that you can keep abreast, because things happen so quickly, or sometimes it seems that they don't happen fast enough. But we are committed to posting our latest information on our website. So please check frequently because sometimes things change rapidly. Thank you.
All right, thank you.
Dr. Ruffin, I know time is short, so I just wanted to just end with just one last question, because again, I'm a parent, but I'm also a parent liaison in one of the schools, and I'm just at this point, I feel like I'm kind of, if we have to go in person, I feel like I'd have to, like I'm choosing between my job and my livelihood and whether or not I want to send my son in what I see to be an unsafe environment. So I just ask that you please consider giving some of the support staff the same flexibility that you may be giving the parents as far as being able to do our jobs virtually like we did from March through the end of the school year, especially with the fact that there will likely not be a lot of parent traffic within the school. So, you know, we're able to still utilize technology as far as emails. You know, even if we did some virtual, if I had to meet with a parent or explain something to, just the use of technology with our jobs too, because, you know, as a staff member, but also a parent, you know, like I said, my concerns are coming from both sides. So please don't forget about us, and just hopefully virtual option will be given to us as well.
Thank you. Thank you very much for your comments. And I'm going to respond to your comment, and then I'm going to close our meeting for today. You know, I think about all of you all the time. And I hear what you're saying when you're sharing with me the uncertainty that you feel or the concerns that you feel for yourselves, your families, your children, other staff members. I understand that, and I totally respect that because it's something that is the forefront of my mind every single minute of every single day. And I want to thank all of you for calling in, sharing your thoughts and your concerns. This is a critical time for us. It's not like we have a model anywhere that is perfect, because it doesn't exist. So if someone says that it does, it's not true. So but it is a very challenging time. That is true for all of us as we're trying to navigate so many uncertainties. We are working collectively to try to put together as great a plan, knowing that it's not going to be perfect and knowing that we will make some mistakes. What we cannot afford to make a mistake in is to the health and the safety of our students and our staff and our employees. And we're trying really hard to make that the primary concern as we navigate this challenging time. And you're correct. We don't know what the status is going to be. Our meetings are virtual because it's the 14th of July. We don't know if our meetings are going to continue to be virtual on the 27th of August. But for the time being, we're not talking about what's going to happen in the remainder of July. We're trying to project what might happen in September. And so that's why we're trying to have these meetings now to help us to get to a better place whenever we do open, and to always keep the safety of all of our teachers, our students, our families, and our community safe. So I thank you for your input. I thank you for your comments. You know, stay tuned to us frequently. Website and emails, because I still do send emails to staff, and I also send we also have a presence on social media, which is monitored by our Director of Communications, Ms. Sujatha Wyckoff, and we'll continue to give you up-to-date information. And please don't be surprised if that changes frequently, because sometimes in this uncertainty of the moment, you'll get one piece of information 1 week and then it may change the next. And sometimes it doesn't change for a while and then it changes abruptly. So please do stay with us, and we're trying to keep you informed with real-time information as soon as we get it. I thank you in advance for being here today, and I look forward to the next town hall meeting that we will have, and to continuing the dialogue throughout the summer. Thank you very much.